we've got a couple of 2.4 things.
Yeah, but
I know Senator Williams
it's been
wants to.
Well, I just want to take you to the primary health care in relation to the government's funding $6.8 million over 4 years for the Parkinson's nurses. Who's the best to speak on that? Thank you, committee, for this. I appreciate it.
yeah.
This is the recent announcement, is it? Sam?
Yeah.
Louise.
Mrs Edwards.
Yes, Senator.
$6.8 million over 4 years. How many nurses in regional Australia will that fund? Would you have any idea?
I'll hand over to Ms Riley,
Ms Riley?
who knows more about this measure.
You're the accountant, Miss Riley, are you the dollars, figures
expert.
person?
Thanks, Senator. Louise Riley, Assistant Secretary, Primary Care, Dental and Palliative Care Branch. So that measure is looking at improving access to specialised nurses, focusing on neurological conditions, including Parkinson's, in 15 locations.
15?
Yeah.
Western Australia already has some in place for about 10 years by the state government, is that correct?
I would be relying on you for that, Senator. I think so, yes.
Don't rely on me. I think Tasmania, Victoria, New South Wales have some in place, like Parkinson's. New South Wales have 5 or 6 in place now. So 15 over Australia now. Who will determine and how will it be determined what area, what regions get those, one of those 15 nurses?
So, Senator, the approach will be through an expression of interest process with the PHNs. It may well be that...
Explain that in expressions of interest to the PHN.
So, sorry, Senator.
Yes.
The 31 primary health networks across Australia.
There are 31, right?
Yeah, so they'll be invited to submit...
Does that include the cities?
Yes.
Yep.
So it includes all regions, covers the whole country. They'll be invited to submit an expression of interest to access the funding for one of the sites.
When do they have to do that by?
That'll be rolling out in early next financial year.
Right.
I guess it's important to note that the funding could be for existing nurses to upskill them, or it could be to employ a new nurse. These nurses could be already working with patients, and it could be to expand what they're currently doing.
Well, Ms Riley, what if you get 31 expressions of interest and there's room for 15?
Well, that's when we earn our money, Senator. We have to make assessment and decisions and give advice to the government as to where we should try. I mean, notably, this is a pilot to find out what's the best way to provide additional nursing care for these types of patients. So we'll be looking for innovation in what to do next, integrating and building on whatever is there already, and real thought about how they might reach out to patients in the community.
Ms Edwards, when you make those really good decisions, I hope you take into consideration regional Australia, which has little or very slow access to neurologists.
We absolutely do.
Because, take where I live in northern New South Wales, if I want to see a neurologist, in fear I have a neurological disease, MS, Parkinson's or whatever, I could wait 12 months to get into one at Tamworth.
Yep.
And that's where I hope you take into consideration where it's easy to access neurologists, or easier in the
We
urban
absolutely
areas.
do, and what we would normally do is, with a trial like this, is have a mix. So we'd have some of the being rolled out specifically in remote and regional areas so that we can see how PHNs are commissioning nurses to do things there, and some in the city so we can compare measures. But we're absolutely acutely aware of the difficulties of access in remote and regional areas, and we take it into account.
Next question, let's say it comes early July, you've had a lot of the expression of interest, you can place the 15 nurses. Do you have the 15 nurses?
15 locations.
Locations, that's what I mean, but 15 locations, put the nurses in. Do you
as,
have those nurses
well, as
available?
Ms Riley said, the expressions of interest we'll get from the PHNs. In some places, they'll be wanting to do extra training for existing nurses who may not have this particular specialised skill, so then that's in order to build that. In other places, it'll be people already trained. We want to look at building the workforce, building the skills. Some places you could imagine they might be saying, well, how do we impart this sort of knowledge to a broader range of nurses? So say in a regional area where you've got a visiting district nurse, actually teaching him or her how to deal with these sort of patients as an additional. So we're open to a range of possible service models, and that's why we're doing the expressions of interest.
The last question in relation to those models you're open to, would you be happy to work with, say, Parkinson's, New South Wales, who already put the nurses in place, they know what they do, they've trained them, they've funded them, etc. Would you be working in collaboration with people like Parkinson's, New South Wales, in the state of New South Wales?
Absolutely. We're certainly taking into account the expertise that's already out there, and as I mentioned, making sure we're actually integrating. We don't want to duplicate or take over, we want to work with what's there.
Well, let's hope also the states come forward as well, because I've been told, I don't know if it's fact, but the actual Parkinson's nurses, the savings to the states actually saves them money on their hospital budget because of less falls, less accidents, less broken limbs, etc. So I would hope the states come on board.
Yep. Well,
as
and
well.
we've talked about already today, one of the key things we're working with on the states is reducing avoidable hospitalisations.
Yep.
One, because it saves a lot of money, but actually because it saves a lot of misery as
Exactly.
well. And so absolutely that's one of the things we'll continue to look at.
Thank you both. Wish you well. Thanks very much. Thanks, Chair.
Thank you.